I'm going to just move directly on because a few family members have came forward, so I'm going to try and keep it as short as possible so we can hear from everybody. So next up is Graeme Smith. Graeme is the chair of the City of Edinburgh Council's Unite and Unison branch. Just with Nick, Graeme, I'm going to give you 10 minutes and then I'll interrupt you annoyingly with a 2-minute warning, okay? Thank you.
Thanks very much. So, welcome all tonight. Just to clarify, I'm the chair of the Unite branch. We'll have a speaker from Unison later. I'll be nice, short and sweet with this, as Nick thankfully went over quite a lot of my points. But we've got quite a few concerns about both the initial effect this will have on residents and the staff within the homes, as well as the sort of long-term impact. I mean, the 5 homes that have been marked for closure employ currently around about 280 jobs. So there's been no consultation with the staff prior to this paper being done, and it's been submitted without any consultation with the trade unions. We are now in ongoing dialogue with some rather sheepish members of the Edinburgh Health and Social Care Partnership. However, they still seem to have no consideration of consultation with residents and residents' families. The only sort of discussion they seem to have had is there will be what they're calling it consultation after the decision about the homes has been made. So, for the initial impact for the homes, they seem, as Nick sort of gone over, it seems to be very much going into a private model. There seems to be the move to lose what we currently have is 506 residential care beds. That would be cut down to 180, would be 290, including the ones that are managed by Four Seasons. However, these are to have a sort of nursing home capacity rather than low-level residential care needs. The paper put forward for this bed-based care, which is where the care home proposal comes from, basically says that if residents would be looking for residential care in the future, it's ample in Edinburgh through private providers. So that's one option. You go instantly to the private sector if you want residential care. The main focus seems to be on home-based care. However, with home-based care, there are a lot of, you're at the vagaries of the market for many things, and there are also lots of different variables that come into this. So if you think about the isolation that people can face in their homes as opposed to in a care home, is to be warded off by community projects. However, we have to understand all of this in the coming context of post-COVID austerity. And these community projects, would they be delivered by public sector or more likely by private sector? And obviously the difficulties ensuring sort of consistency of service with these would put residents at a great disadvantage. Some of the other problems in the community we can sort of foresee are like social isolation. One of the ones is environmental impact. So the bed-based care strategy seems to suggest a positive environmental impact, which I think is purely a positive impact for the partnership. If they close homes and reduce their carbon emissions, there's been no sort of cognizance of the fact that moving people into home-based care will increase the number of journeys. If these need to be cared by home care workers, will increase fuel costs for these residents. There are many things that don't seem to have been considered when the move to a home-based care model as opposed to care homes has a whole number of variables which the price to be paid would be by the service users themselves. With this coming in the context of the Feely report, which is not aiming at a publicly owned and operated national care service, but a national care service more as a commissioning body. We'll next touch on these points. One of the concerns that we have for this, as Nick said, local authority care expensive, private sector care cheap. One of the other things with austerity looming over us is, as local authorities have to bid for these along with private care providers, whether local authorities bother in the end. And this could be yet another step in the way of local authorities cutting services if they can't compete with private care providers for their low costs, which are often driven by low staff pay, poor terms and conditions for staff. And speaking to some colleagues, and some of the stories you hear from private care providers are terrible care workers without access to a toilet, having to move through people's rooms in order to get use of their ensuite facilities without sufficient sort of places to sleep. These are all the things that we'll be going into. So we'll be losing public sector jobs with positive terms and conditions that would actually protect staff, and as we've seen, been highlighted very much through the COVID crisis, would also protect the residents. One of the initial proposals from the report is moving the staff that are currently in the care homes into home care, reablement teams and community support, which would be a radical change of jobs for these staff who previously built up great relationships with the residents of the care homes. They've got one static place of work, whereas these workers are now at threat of becoming peripatetic workers. So I think with the move to focus on the private sector for deliverance of care, there's lots of risks with this. Risks both to employees that provide the care as well as the residents and service users. I think Des Lockney put it very well in the recent deputation. I think what we really need to be looking for here is, rather than the closure of these homes, if there is a closure, commissioning new build care homes to replace the places lost, to ensure they're staffed by local authorities with terms and conditions that are protected above and beyond those of the private sector.